If you're a parent, you've undoubtedly had some questions about childhood vaccines. Namely, are they safe? I'm Rochelle Grossman with your latest health news. The latest medical review funded by the U.S. Department of Health and Human Services found that immunizations for children overwhelmingly offer more benefits than risks. Researchers found a few serious side effects, including seizures resulting from high fevers after the MMR vaccine and a bowel condition associated with the rotavirus vaccine. They say if you have questions, you should discuss vaccinations and their safety with your child's pediatrician.
Women who have pregnancy complications may feel relieved when a healthy delivery is in the past, but if you had high blood pressure during pregnancy, you may want to let your post-pregnancy physician know. I'm Jennifer Dodd, and this is a Dailyrx Minute. A recent study found that women who had pregnancy complications related to high blood pressure were more likely to have risk factors related to heart disease and diabetes a few years after giving birth than women who didn't have high blood pressure during pregnancy. Tell your primary care doctor if you had preeclampsia. For Dailyrx TV, I'm Jennifer Dodd.
At one point or another, almost everyone gets constipated. Fortunately, most cases can be resolved with simple changes to diet and exercise. Sometimes, though, constipation can lead to complications. I'm Erin White, and this is a health feature. Constipation is a condition in which a person has fewer bowel movements than usual. In any given person, there may be several causes for constipation, including a lack of fiber, not drinking enough fluid, an inactive lifestyle, and changes to one's environment. However, constipation may also be associated with a more serious condition, such as diabetes, scleroderma, thyroid disease, multiple sclerosis, or Parkinson's disease. In most cases, constipation is acute and not likely to cause serious problems, but it can still cause complications. These may include hemorrhoids, anal fissures, rectal prolapse, and fecal impaction. Treatment options vary depending on the cause, severity, and duration of the constipation. Fiber-rich food is necessary to normalize and maintain bowel function. Reducing the amount of refined and processed foods, such as processed meats, cheese, and ice cream that you consume each day may also ease constipation. Instead, choose foods with natural fiber, like vegetables, fruits, beans, cereals, and breads. Exercise daily and ask your pharmacist if your medications can cause constipation. If so, talk to your primary care doctor to see if a change to your medication or stopping altogether is right for you. In severe cases, surgery might be needed. Biofeedback, a method that can be used to retrain the anorectal muscles, may be another possibility. Eat plenty of fiber, exercise daily, and speak with your doctor about any constipation issues you may have.
A stroke is an event that occurs when blood flow to the brain is stopped or interrupted. Decreases in blood flow to the brain can cause symptoms including sudden numbness, confusion, difficulty with seeing and speaking, and abrupt severe headaches. There are two general types of stroke, ischemic and hemorrhagic. Ischemic strokes are caused by blood clots that may block blood vessels in the brain. Hemorrhagic strokes are caused by broken blood vessels in the brain that result in bleeding and loss of blood supply. Patients at risk for strokes include those that have high blood pressure, high cholesterol, or diabetes. Alcohol abuse, illegal drug use, and cigarette smoking have also been linked to significant increases in stroke risk. Strokes are serious medical emergencies and can often be difficult to treat. Some strokes require blood thinners and other medications to prevent future blood clots. Others may require surgery or significant prolonged care. Post-stroke rehab is often needed to help patients overcome disabilities that result from stroke damage. The best way to deal with strokes is to prevent them from recurring at all. Eat a healthy, balanced diet, monitor your cholesterol carefully, and get plenty of appropriate exercise.
As the popularity of youth ice hockey has grown in recent years, the injuries associated with it have grown as well. I'm Erin White with your latest health news. The American Academy of Pediatrics wrote that one of the most important ways to reduce injury risk was to expand programs to prevent body checking in the sport. Body checking is deliberately obstructing an opponent by putting one's body in their way. Dr. Michael Ishitani, a pediatric surgeon at the Mayo Clinic Children's Center, says due to the fast, hard-hitting nature of the game, people often ask what kinds of injuries might happen to my children.
The most common type of injuries were fractures, which may require splinting, casting, or even an operation to treat. The next most common type of injury was traumatic brain injuries, or more commonly known as concussions.
Speak with your child's coach about safety rules in their sport.
With more than 1 million new skin cancer cases in the U.S. every year, we all know we should wear sunscreen when spending time outdoors. But which sunscreen is best? I'm Rochelle Grossman, and this is a health feature. Thanks to tighter FDA regulations, we now have easier to understand labels that require makers to back up any protection claims. For example, sunscreens with an SPF of 15 or lower must carry a warning that reads, "Skin cancer, skin aging alert. This product has been shown only to help prevent sunburn." And products have to be realistic in their claims. Sunscreen can no longer claim to be waterproof or sweat-proof, and they can't claim to provide instant protection or protection that lasts longer than 2 hours without reapplying. You must reapply, and the new labels specifically tell you how often. And what about the letters UVA and UVB? Do they confuse you? Well, here's a quick lesson. Sunlight that reaches us is made up of both ultraviolet A and ultraviolet B rays. UVB rays result in sunburn, and all sunscreens offer protection from them. However, UVA rays account for 95% of the radiation we're exposed to. These rays sink deep into the skin and cause tanning, which causes aging, wrinkles, and cancer. If your sunscreen claims to be broad spectrum, it must block out both. Experts agree there is no safe amount of tanning, so they advise you to cover up, avoid the midday sun, and don't let cloud cover fool you. And those tanning booths, well, you might want to pass. According to the Skin Cancer Foundation, UVA radiation inside a tanning booth can be 12 times greater than that of the sun.
By translating health information into a consistent, easy-to-understand language, the Dailyrx News Network enables you to take control of your health. Sign up for the Dailyrx newsletter to receive the latest health news and videos right to your inbox every morning. For trusted, research-based health news, join us at Dailyrx.com. Your health starts here.
One of the scariest moments for a parent can be seeing their child hit in the head, especially if that hit is hard. If they sustain a concussion, it's important to know some guidelines for recovery. I'm Mindy Cook with your latest health news. Guidelines were recently published to help doctors in diagnosing and treating concussion injuries in children, but the information is valuable to parents as well. Red flags to note following a concussion involve neck pain, confusion, irritability, repeated vomiting, severe or increasing headaches, and unusual behavior changes. The published guidance suggests taking your child to the hospital if you notice these symptoms. A doctor should give advice on how to manage sleep, fatigue, and social interactions. Rest your mind and body while recovering from a concussion.
Multiple sclerosis, also known as MS, is a disease that affects the nervous system, especially parts of the brain and spinal cord. Nerve cells in these parts of the body begin to lose their protective myelin sheaths and become damaged. This causes many different negative effects on a patient's health. Early symptoms of MS include eye pain, difficulty seeing, muscle weakness, balance problems, prickling in the faces, arms, and legs, and urinary issues. Caucasian patients, women, and patients between the ages of 25 and 40 appear to be at a particularly high risk for MS. The cause of MS remains unknown and there is no cure. Certain medications are effective at slowing down the progression of MS in some patients. These include many newer drugs including fingolimod, natalizumab, and terflunomide. Physical and occupational therapy may also help patients manage MS symptoms over time. Some patients will eventually need help walking or performing daily activities. Early detection can help with the management of MS. Your physician may need to perform tests including imaging scans to diagnose MS.
Here's some good news for Americans waiting for a kidney transplant. Older adults who donated kidneys were not at an increased risk for heart problems, kidney disease, or dying. I'm Miranda Savioli with your latest health news. A newly published study from the University of Pennsylvania found older kidney donors did not have a different survival rate when compared to non-donors. There was no difference in rates of heart and vessel disease between the two groups, nor was there an increased risk for diabetes, low thyroid function, or osteoarthritis for older donors. However, older kidney donors did have a 53% greater chance of being diagnosed for non-melanoma skin cancer. But the study's authors feel this may be because donors might visit their doctors more often. Speak with your doctor if you are considering a kidney donation.
Parents want to keep their children safe and healthy. So Dr. Ari Brown reminds her patients that vaccines are important, safe, and effective.
The truth is that vaccines are very safe and vaccines do their job. And the diseases that they are protecting against are quite real.
That's why doctors of the Texas Medical Association started the Be Wise Immunize program. They've given more than 100,000 free or low-cost shots to Texas children.
Vaccines have been one of the most important ways that we've been able to prevent serious illness and death in children.
Texas Medical Association, improving the health of all Texans.
COPD, otherwise known as chronic obstructive pulmonary disease, is a condition where the airways to the lungs are blocked from performing as well as they should. COPD may only cause mild symptoms at first. COPD symptoms include a cough that produces a lot of mucus, shortness of breath, especially with physical activity, wheezing, and chest tightness. Without proper management, COPD symptoms can become more severe and can even become life-threatening. A large portion of patients with COPD are active or former smokers. Long-term exposure to other lung irritants such as air pollution, chemical fumes, or dust may also cause or worsen COPD. There is no cure, but many treatments may help relieve symptoms. Bronchodilators, inhaled and oral steroids, and tiotropium are safe and effective medications often used. Oxygen therapy, surgery, or even lung transplants are sometimes necessary for certain patients. Patients with COPD or those trying to prevent COPD should avoid smoking or working in settings with poor air quality. A healthy diet, proper exercise, and other healthy lifestyle choices can also help prevent or manage COPD in many patients.